This is indeed a deeply emotional moment filled with a great hope. But alongside our joy, we must show restraint, humility, and compassion. Since we do not know the exact medical or mental condition, the health system is ready for every possible scenario, including careful monitoring under the refeeding protocol based on lessons from past return operations.
Hospitals and their doctors in Israel say they are ready to receive the 20 living Israeli hostages that Hamas is expected to release just hours from now.
Every returnee has a capsule of caregivers, a doctor, a nurse, a psychosocial worker, a dietitian, and they all take care of one returnee, and that's the same team that will follow him in rehabilitation also.
Let's bring in Fox News senior medical analyst Dr. Mark Siegel. What a challenge these medical teams are going to face when these hostages are finally released after more than 2 years in captivity, Doctor.
Absolutely, John. The Israel Health Ministry reported to the International Red Cross about a month ago what they believe to be really horrific conditions for the hostages, that worse than we could even imagine, shackled together in very small spaces, not seeing sunlight, going to the bathroom together, eating extremely small amounts of food, subject to parasites, to infections, diarrhea, psychological torture, physical torture, 1/3 of them having at least terrible physical injuries like gunshots or broken bones. Now, when they recover, and I've been talking to the doctors at Sheba Medical Center that are going to get a majority of the hostages, they're going to be met with warmth, with love, with kindness, with sensitivity, with compassion, with a multi-teamed approach. And it's going to be an extremely slow process of re-entering life. Now, one of the things that you have to know is if you're severely malnourished, John, they can't just suddenly feed you immediately what you should be getting. That would cause even more metabolic disruption. There's probably vitamin deficiencies and infections that all have to be treated, and they have to be treated slowly, especially when it comes to the malnutrition. And the psychological treatment also has to be very, very slow. There's going to be severe post-traumatic stress disorder, depression, anxiety, but coming together with family members and people who care is going to make a huge difference.
The psychological component of this has to be, I would think, the most difficult, really. I mean, you can kind of assess somebody's physical needs and figure out what is going to help them, but the psychological component, that's going to be difficult, isn't it, Doctor?
Yeah, absolutely. Even if you treat the anxiety up front and the depression, there's going to be over time flashbacks, derealization and depersonalization, loss of reality, terrible bouts of going back where you were. And again, that's where love, and not to mention the impact on the families who have been suffering so greatly to know if a person's alive, if they're not, what condition they're in. People like Ilya Sharabi that came back and found out that his family was gone. I mean, it is such tragedy. I hate to bring this up, but it's reminiscent on a much smaller level of what Jews experienced in 1945 at the end of World War II, coming out of the concentration camps.
Yeah. So the Israelis have obviously planned for a medical team to surround each of the hostages. So many of them were injured, as you said, during the actual attack back in October of, 2 years ago. And it was, there was very little medical treatment provided to them, as far as we know, when they were taken into those tunnels underground. I mean, some of them had their Achilles tendons cut, that kind of thing. There are going to be some horrific injuries that these hostages, the medical teams for these hostages, have to deal with.
That's two great points you just made, John. One is the orthopedic injuries, and I said also maybe shrapnel injuries. And those are going to have to be dealt with really quickly by a tremendous team of trauma experts. I know Dr. Joseph Haidt there, who's the head of plastic surgery, is just terrific. I interviewed him just the other day. And physical injuries are going to be a huge challenge and will be dealt with right away. The other thing, though, the team, the social workers that work in these medical centers and the psychologists, together with the families, will basically deal with the psychological upfront issues, especially people that have, again, not seen daylight, or those who have underlying conditions. There are people there, some of the hostages that will be released, one has severe asthma, another one diabetes, probably untreated. Those will have to be addressed right away, the underlying medical problems, and those that were induced by all of the abuse as well.
Yeah, there's going to be a lot of PTSD kind of medical reaction or mental
For years.
reaction. Yeah. Go ahead.
For years, and people will never be the same, but they will be better. Thank you, John.
All right. Dr. Mark Siegel, we thank you.
Hey, it's Will Kane. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Kane podcast for full episodes right now.